Hi, my name is Phyllis Amon, and this is Senior News for today. In the news, according to an article in the New York Post, a law has been introduced that would require nursing homes and hospitals to maintain minimum staffing levels. Though this has been a long-standing issue and well acknowledged by advocates, researchers, and known by healthcare workers, it was the recent report by Attorney General Letitia James indicating that the most coronavirus deaths were linked to nursing homes with the lowest or near lowest staffing levels. Nursing homes and hospitals would therefore be required to maintain adequate minimum staffing levels under the proposed state law, which has gained support in the wake of the report. It's no secret that many nursing homes, and especially those that are for-profit or part of for-profit chains, are understaffed. During the pandemic, workers also were inadequately supplied with PPE, and for the most part, they're underpaid. The Safe Staffing for Quality Care Act was introduced earlier this month prior to the Attorney General's report. The bill would establish minimum standards for nurse-to-patient ratios. Lack of compliance would expose a facility to revocation of the facility's operating license. The new law would require that one registered nurse would not be responsible for more than 5 acute care patients in a nursing home. And it would require minimum standards for certified nurse aides and licensed practical nurses in order to ensure that every resident receives adequate care. The legislation also establishes minimum nurse-to-patient ratios for varying hospital wards, including a 1-to-1 ratio in operating rooms, trauma units, and maternity wards for advanced stages of labor. Previous attempts to establish minimum staffing in nursing home facilities have not been successful, primarily because facilities object to the outlay in additional funds that would be required to hire more staff. The article reports that Michael Balboni, the executive director of the New York Greater Healthcare Facilities Association, noted that the reason attempts to establish minimum staffing levels in the past were unsuccessful is because the state refused to allocate additional funding to facilities. Richard Mollett, executive director of the New York Long-Term Care Community Coalition, is quoted in the article saying, "The Attorney General's report confirms what we have long known. Though staffing is the most important indicator of a nursing home safety, due to lax enforcement, most facilities fail to maintain sufficient staffing." It would require each facility to implement individualized staffing plans that meet minimum requirements and are developed with input from frontline staff. The act is the guarantee for New Yorkers for safe, quality care and would bring to a system of care the equality so terribly lacking. Please click the button below to like and share this episode, and to continue receiving Senior News for today, please click the button below to subscribe. Until next time, stay safe, stay well, and stay tuned.